Berger, founder and owner of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island.
Good afternoon, and I'm Irina Berger. I'm a co-founder of Northeast Medical Practice, and I'm also administrative director. So, Dr. Berger, thank you so much for your time this morning, but I have a couple of questions for you. Can you elaborate on longevity?
Sure, the topic of longevity in a medical context has become quite popular lately, and rightly so. But when we think about longevity medicine and the term longevity, we shouldn't just be thinking about lifespan, how long we live. We should be thinking about health span. In other words, what kind of quality of life do we have during that time period? Traditional medicine, for the last, more than 100 years now, give or take, has been about, treating disease as it comes up acutely, and has developed the ability to treat diseases chronically, like blood pressure and diabetes, but often with the addition of medications as the disease progresses, not reversing it, and of course certainly hasn't prevented it in those cases where it needs to be treated. So we need to focus, like we do here in our practice, on prevention, but also reversal of metabolic disease. And I look at the mother of most of these chronic metabolic diseases like blood pressure, diabetes, cholesterol, osteoarthritis, sleep apnea, as well as cognitive issues like Alzheimer's, dementia, as being related to one's weight. And when I say weight, I don't just mean the number on the scale, I mean your body composition. I'm really referring to adiposity, excess fat tissue. That's why I pursued, before it became such a hot topic in the news and so on, a board certification in obesity medicine, because I think if we can control one's weight either by not letting it get high and increase in the first place, or reversing it and treating it like the chronic disease that it is for a lot of people, then all of those downstream problems, they can be controlled. We can get people off of their blood pressure medicines and other medications, different diabetes medicines, etc.
And you also, in previous podcast, you were actually talking about fatty liver. It's also multiple types of cancer, right? I mean, you mentioned about 13 types of cancer.
Absolutely, and it's a good point to raise. Yes, 13 types of cancer, some of the most common ones that people deal with. And yes, fatty liver, we talked about the benefits of black coffee and fatty liver recently. But fatty liver is a big risk factor for progression to either hepatocellular carcinoma, liver cancer, or cholangiocarcinoma, cancer of the bile ducts and the gallbladder. So prevention, very important, and that's what we focus on here in our practice. And just to compare and contrast a little bit the way we practice here at Northeast versus what you might find in the traditional medical setting, which I practiced in for a number of years. And many of my colleagues are, still trying to fight the good fight in that setting, but are really restricted in the amount of time that they can spend with patients. It's not through any fault of their own. It's the way the system works. If you're seeing 30 people a day in a primary care clinic, you can't spend enough time to get into all of this prevention. It's always the biggest struggle, is you really only have time to write a prescription or adjust the medicine they're already on. In our practice, we can give the patients pretty much as much time as they need for us to try to get into these issues, and of course have them come back whenever needed, do it by video, sometimes even over the telephone, and so that we can work on not just extending the length of one's life, but making sure that you have a high quality of life during those additional years, and that, while we can't totally prevent a lot of the diseases that eventually take the lives of people, the idea is to really postpone them and have any period of disability and ill health from them to be really minimized in that last part of life, not to live with a terrible chronic disease and be debilitated for 10 plus years in the last decade or more of your life.
Yeah, it's not a life, it's suffering. And so you're taking, talk a little bit about the lifestyle. I mean, I know you rely a lot on um, obesity medicine association, and speak a little bit about what are the pillars of lifestyle. What do you, preventive care, but also, day to day, what do you teach your patients, and what is really, must do? Because there are a lot of myths, wrong myths out there. So, what does it include, and what do you usually do?
Of course. So, and this is very individualized to each patient. Some of the pillars you would think of right off the top of your head, but some you might not. So, of course, proper nutrition, one of them. And next would be exercise and physical activity. Most people would think about those two. But sleep, exceedingly important, and really kind of the foundation for everything else, because you don't want to exercise if you haven't slept well. You don't, your appetite increases and you crave things that are less healthy when you haven't slept well.
One triggers another. It's
Exactly. So sleep is really foundational, and in our busy modern society, not really focused on, and a lot of workplaces they just overload their employees with so much work that it makes it very, very challenging. And going with that is stress, chronic stress, which increases blood sugar, makes it harder to lose weight, interferes with sleep, particularly when it's to the level of anxiety and so forth. So proper sleep and managing stress, often not thought about, and certainly in traditional practice, there's no time to talk about those kinds of things really. Avoiding risky substances, of course, not too much alcohol, avoiding nicotine, other drugs, etc. And having really good social, family, friend connections, very, very important, something that you're able to get into with our patients in your health coaching. And that's also a piece that a lot of practices don't have, and health coaching really like a powerful treatment in and of itself, because I can speak to the patients and give them direction and so forth, but without the accountability and the time that, in additional time to what I do, that you're able to provide to the patient, very important.
Yeah, I think the biggest advantage that you're meeting on a weekly basis, and you basically prioritizing and you planning, right? You remind people in our crazy lives that, listen, there is nothing more important than your health. You need to prioritize your health, number one. And let's plan in terms of meal, let's plan in terms of exercise, and we rely on SMART model. And I think helping and constantly reinforcing and being on the shoulder of the patient and constantly reinforcing the message, I think we're accomplishing, not us, it's actually evidence. They're saying 80-90% of success if you work with a coach.
Right, and weight management clinics in particular, that much higher success rate. So all of those pillars very important. I basically meld the pillars of lifestyle medicine with those of obesity medicine, and of course obesity medicine is not just about lifestyle, it's also about that additional tool in the toolbox very often of proper medication. So of course I think very important to see someone who's board certified in obesity medicine, which is something that I can offer to my patients, that additional training and knowledge, to make sure that we're doing things properly with regard to that. But so we focus on that whole preventive piece to try to extend the quality of one's life, not just the length. But we also, of course, provide all of the acute care that a patient would need in the outpatient setting. So the garden variety, sore throats, bronchitis, sinus infections, ear infections, pneumonia, joint and muscle problems, low back pain, etc. In the office, but also for patients who elect to have it, the plan that includes house calls. So I'm happy to do that. Even on a holiday 2 days ago, the 4th of July, we went to visit a patient to help with an acute illness, diagnose and treat. And also when our patients do actually need the hospital, that I go and advocate on their behalf.
Yeah, it's a very, very big need because again, we're hearing from patients that staff is negligent. They not when I call for help and nobody shows up. Like it's and even through personal issues like dealing with elderly parents right now. I mean, we never leave mom in the hospital by herself. We always somebody's there, and we treat our patients exactly the same. And I know it's not only elderly people. Like we had recently an incident with one of our young patient who was working out and he had hit and run, right? And you actually had to go to the hospital.
It may be something like getting hit while riding your bicycle. We've had multiple other acute problems that patients have needed to go to the hospital for. And so it's not just the elderly folks who have multiple medical problems and are hospitalized frequently, but also our young patients, our middle-aged patients who may have issues that.
So what exactly do you do there? You're meeting physically a patient in the emergency department, and what is your role? What do you do? How do you advocate?
Right. So I'm not the admitting physician. All the hospitals have their own doctors, of course, in the ER, but also upstairs, if you're admitted, they have what are called hospitalists, hospital doctors, who they rotate typically 7 days on, 7 days off. They don't know the patients well. It's not like the old days where your primary care doctor would be your admitting physician and round on you every morning as their own patient in the hospital. So when you go to the ER and if you're admitted, you're in the hands of doctors who are highly trained in doing the very best that they can. But they have a lot of patients and they don't know you personally because they probably haven't met you before. So my role is in the emergency room, number one, to make sure that I give what's called a warm handoff in the business, meaning the ER doctor knows exactly why the patient is there, what's been going on lately, what medications are they on, what chronic medical problems do they have, what relevant surgeries might they have had. Things like this. Patient may be too sick to tell them, may not have a family member with them, they may have never been to that hospital before. That puts the ER physician at a great disadvantage. And they actually often appreciate me being there because they don't need to try to get a hold of the medication list for the patient in the middle of the night. The pharmacy's closed. It really provides better and more streamlined care for the patient. I believe it, in a lot of cases, it decreases the amount of testing that needs to be done because the problem becomes much more focused for the ER staff because I can tell them what's been going on and what the history of the patient is. But it's not only that medical piece. I think a lot of patients just appreciate the presence of their primary care doctor there to support them and just be there with them during this really vulnerable time. I mean, even as a doctor, whenever we end up in the hospital, or if we need to go for a surgical procedure or whatever, we become just as vulnerable as any other patient who's not trained in medicine. It doesn't really matter. When you're in the gurney with the gown on, you're very vulnerable. And I think having your doctor that you've worked with for X period of time, who knows you and who's taken the time with you in the office because it's a concierge-style practice, I think can be very comforting to the patient and the family as well. They know that somebody's looking out for them.
Yeah, it becomes like a family relationship versus just the number, right? It becomes and I know this particular case that you just mentioned, I mean, the patient was so thrilled. They even wrote review and they said like, I never write review, but I couldn't not to give you a review. Like he was so grateful for the fact that you showed up 15 minutes later and you were helping out. I mean, yeah, this is what you make difference in people's lives.
Exactly. And you bring up the idea of our patients being like family members, and when we've taken care of your mom in the hospital, I mean, we try to do exactly the same thing for our patients, and it's because of our experience with family members who've entered the hospital system and, maybe, we're not getting the care that we thought that they should have, and our advocacy made the difference. That's part of what inspired me to create a practice like this, where that's available to our patients, because I think everybody should have that kind of care where they're treated like a member of the family and somebody's really looking out for them. They haven't just entered the machine that may potentially kind of grind them up in the gears.
So, do you still take new patients? I mean, do you have a big panel? What is your...
So we are still accepting patients. We're beginning to fill, but the way that I'm able to provide this kind of care for our patients is by limiting the size of the panel. So no more than 300 patients, as opposed to the 2,500 to 3,000 that I had when I worked in the hospital system. That's what allows us to provide that different kind of care. So small panel where you know everybody by first name. It's really important, and that's the difference between the traditional system and what we do with a concierge-style practice.
And what is the process of becoming a member of your practice? Like, what would be the route?
So patients who reach out to us, I like to have them come in for a free consultation to tell them more about what we do here, what they can potentially get out of being our patient, and see if we're mutually a good fit. This is not for every patient, and not every patient is a good fit for us as well. It's a relationship that we'd like to create, and not everybody jibes with everybody else. It's like trying to find maybe a mental health clinician, somebody to talk to, and you may just not have rapport. So it's kind of an interview process in both directions, so we can make sure that they're a good fit. We're a good fit for them, and they're also a good fit for the way that we practice here.
Okay. Can you, how the patient can find us?
Of course. So if you'd like to reach out to us, the number here in the office, 516-604-3418. Again, we're Northeast Medical Practice, located in Great Neck, New York on Long Island, and not too far from the city. And you can find us online, our website, northeastmedicalpractice.com, through our variety of social media channels, perhaps the way that you're doing this now, our YouTube channel, also our new podcast called Longevity MD, which is available on Spotify, where I interview other physicians and also give talks on various medical topics. So a variety of ways to find us. You can call the office, you can find us on the website, through our social media outlets, etc.
Thank you, Dr. Berger.
My pleasure. Thanks for tuning in, and until we see each other next time, be in good health.